let's talk about how your metabolic health can actually affect your healing and your chronic pain. I'm Dr. Danny Clark, Director of Orthobiologics here at the Protea Performance Center. Our Performance Center is also in the same building and office as the Protea Medical Center, which is really cool because we have the ability to work with amazing physicians to help improve your overall health, your overall metabolic health, and make sure you're at your healthiest as we're working through your chronic pain journey. So, metabolic health is a really important aspect to healing, and a really simple or obvious example of that is if someone has really uncontrolled diabetes and their blood sugar is super high all the time. They often will see you'll get non-healing ulcers in usually like hands, feet, and places like that. And the reason for that is the blood sugar can damage the blood vessels, small blood vessels and capillaries that are in these areas, and thus reducing blood flow to those tissues. And so the body has a hard time healing those ulcers. So that's kind of like an obvious example of how severe diabetes can directly affect healing. Now, from a more general sense, that still can happen in the rest of our body. If our blood sugar is not controlled and we're not moving well, we're not feeling our best, or another example is women in the postmenopausal phase of their life. After menopause, your hormones essentially tank, and those hormones are also an important part of the tissue healing process. They help to encourage healing of tendons and ligaments and things like that. And so when you're in your postmenopausal phase and you don't have those hormones helping out, lending a hand to those tissues to help them heal, it's going to heal slower than we want it to. So, I have some patients where they were very active, they changed nothing about their lifestyle, diet, exercise, all of that. And all of a sudden they start seeing these injuries pop up, and what would have normally maybe taken a couple weeks for them to heal and go away, they tend to linger and worsen over time, and they're not making much progress. So what I like to do with these patients is to get them started with one of the other physicians at the medical center to help evaluate for things like thyroid health and diabetes and their overall kind of male and female hormones, testosterone, estrogen, and things like that, to make sure we can get those back to the levels that we want them at, to make sure that you have the best possible chance to heal from a regenerative injection. And so if this sounds like something that you've been struggling with, your hormones feel like they're changing, feel free to reach out to the clinic. We can talk through how we would approach that case and what steps we would take to get you to where you want to be pain-free.